Welcome and thank you for joining us for today's media briefing. Our current plan is to hold these briefings 3 times a week, Mondays, Wednesdays, and Fridays. This may change as the impact of COVID-19 on our community evolves. Joining us today is Acting Medical Officer of Health, Dr. Shu-Li Wong, Regional Chair Karen Redmond, and Regional Waterloo CAO. Dr. Wong and Chair Redmond will open with brief remarks. CAO Murray will be here to respond to questions relating to regional operations. Just reminding the members of the media to keep your phones muted. We'll take questions in order of the roll call. I would also like to thank our media partners for their support in getting today's media briefing underway. And now I'll turn it over to Dr. Wong.
Thank you for coming. So part of our commitment to slowing the spread of COVID-19 in our community is to keep residents informed through regular updates. I would like to thank the media for helping to share accurate information with our residents. This morning, I'd like to provide updates on the Ezra Street gathering, returning travelers to Waterloo region from outside of the country, and provide case updates. Regarding Ezra, I was heartened to hear that the Ezra Street event was a non-event. This will have a positive impact in slowing the spread of COVID-19 in our community. I wish to personally thank all those who chose to stand up for our community and for our most vulnerable. You have set an example for young people everywhere. I also wish to express my profound gratitude to our partners who worked tirelessly to protect our community and prepare it for any eventuality. Mayor Jaworski and the City of Waterloo staff, Chief Larkin and our regional police, Chief Van Valkenburg and our paramedic services, our fire chiefs and their teams, President Deborah McLachie and Wilfrid Laurier University, as well as University of Waterloo and Conestoga College, and the Grand River Hospital and St. Mary's Hospital leadership and their staff. Second topic, returning travelers. So we've received some questions over the past 24 hours about travelers returning to Canada. I wish to provide some more details. The Government of Canada issued a broad recommendation to the general public this past weekend. On March the 15th, I informed Waterloo Region residents of this recommendation from the Government of Canada. For healthcare workers and other workers whose positions are deemed critical by their employers, they can return to work as long as they diligently self-monitor, advise their employer that they are a returning traveler, and stop work immediately if they develop symptoms. Travelers who return to Waterloo Region before this advice was communicated to our community can continue to self-monitor up until the end of their 14 days. Travelers returning as of Sunday, March 15th, are asked to self-isolate, except for the groups that I mentioned earlier who can return to work provided they diligently self-monitor and stop working should they develop symptoms. And finally, case updates. First, regarding St. Mary's High School. As you are already aware, a member of St. Mary's High School community in Kitchener tested positive for COVID-19. As a precaution, a letter was sent home to anybody who may have come into contact with the individual on March the 9th. We worked closely with the school and the school board to identify anybody who could have been potentially exposed. We believe this is a low-risk situation, and we have not had any further confirmed COVID-19 cases in the St. Mary's School community to date. Public Health is hearing from the St. Mary's School community, and we continue to ask those who receive the letter to self-monitor for symptoms. I'll also provide a few case updates now. case 9, which we announced yesterday, a male in his 20s who acquired COVID-19 during travel to the United States, tested at Grand River Hospital and is self-isolating at home. Today we have a 10th case, a female in her 40s who acquired her illness during travel to Pakistan, who was tested at Grand River Hospital and is also self-isolating at home. One of our cases remains hospitalized but is recovering, and the other of our 2 cases, who was hospitalized, has been released from hospital. As a reminder, regarding testing of people who have respiratory symptoms in the community but have mild illness, just a reminder that testing does not take place at public health offices per se. Please call your healthcare provider or telehealth if you have questions about your symptoms and want to know what to do. And of course, please call public health if you have any questions about coronavirus. So there's one last thing I want to say. So we've also received questions regarding events that are private, that have more than 50 people. So my strong recommendation is that whether the events are private or public, that they not be held. So I'm asking all event organizers and those who are in charge of the venues where these events would take place to please not hold events with 50 people or more. So that is it for my comments this morning. I'll pass it now to Chair Redmond.
Good morning. It's still morning. Based on the recommendations from Dr. Wong, we have made a decision to close regional administrative facilities to the public until April the 6th. This is in addition to the closure of our library branches, museum, and child care centers. These decisions have a significant impact on those we serve, and we do not make them lightly. However, we feel that they are in the best interest of our community as a whole. Along with our cities and townships, we will continue to deliver the critical services that keep Waterloo Region residents safe. This includes keeping our water clean, our roads safe, our paramedic and emergency services running. It also includes our many public health staff and those who support them working around the clock to respond to this health crisis. As citizens, you have an important role to play as well. For most of you, this means staying home, socially isolating, staying informed, and being patient. Please reach out to those you know who are vulnerable. Reach out to your elderly relatives and neighbors. Remember, this situation is changing rapidly, so monitor the region's public health website frequently, regionofwaterloo.ca/COVID-19. These are challenging times for our community, but we have community partners stepping up to help with solutions. We're in this together, and we will persevere. Thank you all so much for your cooperation.
Thank you, Dr. Wong and Chair Redmond. Now I would like to invite Ashta from 570 to ask her questions.
Thanks, Brian. So I was going to ask, how many parts of our pandemic response plan have we already implemented so far, and what's next in that line?
Yeah, so it's Mike Murray, CIO with the region. So I would say probably all aspects of the community pandemic response plan are in the process of being implemented. We've got 5 different working groups that are underway. There's a health sector working group, a community supports working group, critical infrastructure working group, a communications working group, and a municipal working group. So all of those groups have been active for some time, some more than others, and they're all fully engaged, doing great work, and their work really is to try to ensure good coordination, communication, integration between different partners in the community who are all working on the pandemic response and trying to make sure that all those efforts are well aligned and well coordinated.
Rosie, do you want to change?
Can you repeat that? Keep going.
Ashley, do you have any other questions?
That wasn't me. I think that was Nicole. But I do have more questions.
Please.
I think I have to wait, though.
No, go ahead. We're asking that by media outlet, if you could ask all your questions, then we'll just rotate through the media outlet. So Ashley, you've got the floor.
Okay, so how close are we to setting up assessment centers for COVID-19?
Hi, so this is Shuli. So we do have assessment centers that are associated with the hospitals that are up and running at St. Mary's and Grand River, and will be soon at Cambridge Memorial Hospital. We are also continuing to work with our hospital and primary care partners to open up community-located assessment centers. These will not be centers to do testing of mild community cases, but they will be areas that people who want to be assessed, by a physician, can go to be assessed. So we hope to provide, we will be providing further updates as we have them about that. Thanks for your question.
Thank you, Julie. And when will we have more information regarding case 10? Information on whether she was traveling with family, whether she's been in the community before she was diagnosed with COVID-19, any information like that?
So we hope to have that in the next 24, 48 hours. So since we just found out about this case ourselves, we have to follow up with the case, and then we'll have a better idea in terms of any potential contacts.
All right, and two of the cases that were hospitalized have been let out of the hospital, which is good news. But I was just wondering, when is the decision?
Sorry, one is still in hospital, but is recovering, and one has been released, correct?
All right, so when is the decision made that there's a need to hospitalize people from self-isolation to hospitalization?
That depends on how severely how severe their condition is. If it's the normal process, if people feel that they need to be seen in hospital, then they will be assessed and cared for in hospital. It's a clinical decision by people who see them in the hospital.
All right, and I noticed case number 8 is the only one on the list for our region, at least, that got sick because of close contact. Is there a possibility that the person that got case number 8 sick may have gotten other people sick as well? And what is public health doing to, test people and make sure that people who haven't traveled are also not sick?
Okay, so I'll answer the first part of your question first. So there's more than one case on our list. There's a few that have gotten their infection through close contact, very close contact with previously identified cases. So that is actually the most common way that the infection is spread. That is, it is spread from a case to a close direct contact. So all our cases to date have either had travel exposure or have had close direct contact with a known case. So your other question, if you could repeat it, please.
How is the region making sure that people, or public health, making sure that people who haven't recently traveled are also not sick?
Yes. So as you may be aware, so late last week there was a shift in provincial direction in order for us to not test the people that have mild symptoms in the community and that can recover at home, and shift more of our priority in terms of resource allocation to those people that are more severely affected, such as those in hospitals, as well as to testing those who care for those who are more vulnerable. For example, our healthcare workers. So that said, among groups such as people who are hospitalized, healthcare workers, people in long-term care, et cetera, who develop symptoms, whether they have traveled or not, they are being tested. So that is a way for us to continue to see whether there are cases in the community that have no link to travel. I want to say, though, even though we have no evidence of travel in our community, we must assume that we will have cases coming soon that will have no link to travel or to a case or to another case. And that is why we have already started to implement the measures that we have in terms of, the social distancing measures and the reallocation of resources towards those who are more severely affected, because we know that there will be community circulation, and it's just a matter of time now.
All right, and members of the community have already started to self-isolate. A number of restaurants have closed, for instance. Is this already helping to flatten the curve, or is it a little too early to say?
That's a very good question. It's a little too early to say right now, because there's always a little bit of lag between when people are exposed to the virus and then they develop symptoms and then they're tested, if they're one of the groups we want to test, and then we then know what who their contacts were. So I would anticipate that we should start seeing some effects from the measures that we've put in place in terms of broad social distancing measures, probably in a couple of weeks. Hope that helps.
Yes, thank you so much, Julie, and those are all my questions for today.
Okay, thank you.
And now invite Joanna from the record.
Hi. Just some clarification on the assessment centers. Who would be tested in those then? The community centers?
It is right now who we're focusing on right now. Are the groups that I had mentioned, people who are hospitalized, as well as healthcare workers and people in long-term care homes. Now, depending on resources, these could be expanded a bit wider or be more restricted, and that's kind of a fluid situation. But we're in regular communication with our hospital partners in order to determine, who would be prioritized for testing. So it's a bit fluid right now, and it could change. But right now, we are still recommending that unless you have been recommended for testing by public health, and if you're a case that's in the community, or rather not a case, but if you're in the community and you have mild symptoms and you're able to recover home, that you continue to self-isolate and recover at home.
Mm-hmm. So the ones being that you're planning to set up, though, you mentioned like a doctor would refer people there. Like, I'm just trying to get a sense of who would be going to those community centers.
Yes, that's correct. So what we're trying to do is plan ahead. We want to make sure that even though there are no capacity issues right now in terms of testing the people we want to test and making sure that they're properly assessed, we want to plan ahead and make sure that in the coming weeks we have additional centers and clinics in the community, in addition to the ones that are being set up or have been set up by the hospitals, in order to potentially be able to take more patients in to be assessed. That's correct.
Okay, so it would still be the more severe cases then?
Depending on, we need more severe cases. The cases that feel they need to be assessed and, they, not necessarily hospitalized, but assessed, and that it's not enough for them to stay at home and recover.
Okay. So as you mentioned, people who are more sick, healthcare workers, and then people in long-term care?
Yes, that's the priority list right now.
Okay. And then I was wondering, the St. Mary's situation. Why did it take so long to notify the people that came into contact with the person?
I would say that we notified as soon as we could in terms of when we found out about the potential exposure. We worked very quickly with the school and school boards to get that information out to the people, directly to the people who may have been exposed. So I would say we have, as soon as we had the information that enabled us to act and to identify which particular settings in the school may have had the exposure, we actioned that as quickly as possible.
Okay. And another unrelated question, the homeless population. I know we're trying to keep gatherings very, very small now, but quite often they're congregating in large groups, like say at St. John's Kitchen for lunches. Is there like a plan specifically to try and contain the spread in that population?
Yeah, so Joanna, it's Mike Murray. There's active work going on, like as we speak, with regional staff and local municipal staff and community partners to deal with that exact issue. Because what we recognize is, people who are street involved, people who, are experiencing homelessness, some of the places where they, would normally congregate are closed right now. And so we're actively working on how can we help those people? How can we help them with places to congregate? How can we potentially deal with isolation should we need to with any of the people who are staying in shelters? How can we help them with meals? So that work is going on. There was a meeting just yesterday of the community supports group. I think there were 35 people on that call who are all turning their mind to this. So there's a number of, I would say, pretty creative suggestions and ideas that they're exploring, as we speak. So I think the right partners are focused on that, and I think, within the next day or two, we'll have some more announcements to make about how we're dealing with those.
Okay. That's great. That's it.
Thanks, Joanna. Kate from CBC.
Sorry, I'm here.
Okay.
My phone went dark and then I couldn't unmute myself. Yeah, I had the same question about the homelessness and self-isolation. I saw that Hamilton is looking at opening up rec centers to give space. Is that something, Mike, that the region is talking about possibly?
Yeah, so we're aware of the Hamilton ideas. That's one idea that's being explored because, as you know, some of the city facilities are closed for their normal purposes, so potentially could be repurposed for some of these. There's other, we've got private sector partners stepping up, potentially offering space. So there's a number of options that are being looked at, and I think, partly what's being done right now is looking at what are the potential needs, and then where and how can we best accommodate those needs. So I would say kind of all options are on the table, and from what I've seen, a number of them are quite creative, and they include some of the ideas that you just mentioned.
Right. Okay. And this is for Dr. Wong. We know that people who are being tested are the people with more severe or their health care and that sort of thing. But is public health keeping track of the number of people who are calling and saying, I have symptoms, maybe I was traveling, you should self-isolate, but they're not being tested?
Right now, we are actively monitoring people who have been tested, for example, or people who are cases. We're monitoring about 225 people, so we are actively monitoring those people. When people call in and they say, I have some respiratory symptoms and I've traveled or I haven't traveled, we tell them the same thing, which is to self-isolate. But we do not track all the other people who have not been tested. So we just ask anyone who has respiratory symptoms to self-isolate themselves. until it's been at least 24 hours since they no longer have symptoms. And just to give you a sense of the numbers which have been tested to date, so the total number of people we've tested in the region is over 550. We've had 10 confirmed. We've had approximately 330 who have been confirmed negative, and we're waiting results for a little over 200. So that's just to give you a sense of the number of people who have been tested, and as I mentioned earlier, about 225 people that are currently being monitored by public health. Hope that helps, Kate.
It does help. The reason I asked that question is because I personally know someone who came back from the States. They had symptoms while they were on the plane. They got home and they called their own doctor, who told them just to self-isolate and stay home. And in that case, people might be saying, okay, they probably, likely, maybe, don't know, have it. But I'm just wondering, if we know if there's 300, a couple of thousand people self-isolating, does public health have any sense of just how many people are self-isolating in the region?
No, we don't track that, but we do anticipate that the more people come back from travel, the more we'll have people self-isolating, because when we hear from people, a lot of people are very compliant and want to follow that. That's why, Kate, we can't track and make sure that every single case is accounted for. That's why we ask people to do their part to self-isolate, and that's why we also prepare for the possibility of community spread.
Right. I've just seen some criticism sort of online and stuff, and I'm sure you guys have too, where people are like, we don't really have a true sense of what this virus is doing in the community.
Yes, as I mentioned, even for people that have not traveled but that are hospitalized or that are healthcare workers, we will be expanding beyond travel. So that is one way in which we'll get a sense. We're never going to get a perfectly accurate picture, and that's because we do not have unlimited resources, and we need to prioritize those resources for the cases that most need them and for the people that take care of them. And so we can't, with the number ever increasing every day coming back from outside the country, there is no way to keep track of everyone, and that's why we keep asking people to do their part and to self-isolate if they have symptoms.
Great. And my last question, and I don't know if you can answer this today or if this is something people can get back to me on. We've seen where the Ontario Cannabis Store has said that they've seen an increase in the number of people buying pot and stuff. But I'm wondering if the consumption site is seeing any kind of either bump in users, or if they're impacted in any way in terms of maybe going to fewer hours or seeing fewer people.
Yes, we're in the process of we're about to connect with our consumption services partners, so we'll have that information for you a little later.
Okay, perfect. Thank you so much.
Thank you.
Great. Thanks, Kate. I don't know if Nicole Lampa is still on the call. If not, Zane from CTV. Either of you, please ask your questions. Yep. Zane?
Sure. I think Nicole's probably just waiting to go on air right now. My question is to whoever, I guess, is there a shortage on supplies such as masks for regional hospitals here? Have we heard anything about that?
Hi, this is Shuli again. So for supply issues, because public health is not actually involved in the supply chain, if you're wondering about hospitals, I would recommend that you ask the hospitals. That said, we understand that there isn't an unlimited amount of supplies, and that's one of the reasons that we want to make sure we prioritize those that most need care. That said, I do know that at a high level that our hospitals are working closely together, the ones in our region as well as with other hospitals, and Ontario Health that oversees the hospitals as well as the supply issues. So they are very aware that it's important to ensure that we have sufficient capacity in the coming weeks for a potential a large number of cases in our community, and therefore, I know that they're doing all they can with respect to supplies.
And with, well, fair enough. And then with, it's been said that these masks, the N95 masks, they're not useful for the general public anyway.
That's correct.
So if people have stocked up on masks, are they able to, and maybe this is a hospital directed question then, but are they able to donate them, or is there a process that works around that if public health's involved with that in any way?
No, we don't recommend that people who have bought them and already have touched them and things like that can, return them to the hospitals. The hospitals need to secure, a supply that they know meets all the stringent requirements. And so I do not I just would like to reiterate that I do not recommend that the general public wear masks. There is a supply issue in terms of needing to prioritize those who most need it. So I don't recommend the general public buy and wear masks unless they are symptomatic and or they've been directed to do so by their healthcare provider.
Thank you.
Thank you.
Thanks, Dane. Did any other media outlets join the call in advance of the start of this briefing?
This is Ashta from 570. I had a follow-up question, if that's all right.
Yeah, sure. We're just wrapping up, but go ahead.
All right. There is a ban of 50 people or more in Ontario. So what about essential services like drugstores, theirs? Is there anything public health can do on their side to make sure there's only 50 people inside at a time?
So what we're asking is that all organizations and all, businesses, even if they're not covered under the specific 50 people recommendation, that they do everything they can to enable physically in their organizations for their patrons to be able to practice social distancing. So, what we want to make sure is that where there could be gatherings of 50 people or more, that these not take place, whether they're private or they're public. But in addition, every business can do their part in ensuring that, if they're still opened, that they make sure their customers, their patrons can practice social distancing within their premises. And we really thank them for working on that. We know this is a big change, and it's disruptive, but we really appreciate the cooperation that we've seen so far.
Thank you. That was the only follow-up.
Thank you.
I have a question. LRT and buses, how do you do social distancing on public transit?
Yeah, what we're seeing on public transit, frankly, is a pretty significant decrease in ridership. And so, again, what we're encouraging people is to follow public health direction and, create space for themselves. I would say both what we're hearing and what I've seen personally is, there's lots of room for people to spread out on buses and trains. And, so far, we're largely maintaining the existing service frequency despite the decrease in ridership. And part of the reason for maintaining that service frequency at this point is so that there isn't crowding on the vehicles. The other thing that we've done on ION is the doors open automatically, so people don't have to touch surfaces. So that's one thing. The other thing that we've done on GRT buses is if you've ever ridden a GRT bus, there's a yellow line, and we ask passengers to stay behind the yellow line so that they're not interacting with the operators. And we've actually moved that yellow line back to, again, create a little bit more space between passengers and operators on the bus. And, again, we would just ask all of the passengers to respect that and respect the distance between them and the bus operator, because, the bus operator is providing a critical service, and we would just hope that our customers, our riders, members of the public, give them adequate space as well.
Mike, can I just follow up on that and ask, Guelph just made all their fares free until mid-April to keep people from having to buy monthly bus passes, and they're asking people to board the bus from the back. Is that something the region is at all considering?
Yeah, so we're monitoring what other transit properties are doing. It's something that we're considering. Free fares or, purchasing fare cards, all of that right now can be done electronically. So, so we're not making a change to that. And we feel that by, on the buses, moving the yellow line back has created enough space between passengers and our operators for now. And so between that reduced ridership, we believe that for now, we've kind of created enough social distance on transit and to keep our operators safe and to keep our passengers safe. But, as with everything in this response, we're monitoring it actively. And if, we get to a point in the next days or weeks where we feel like we need to take more measures to keep our operators safe and keep passengers safe and healthy, then we'll do that.
Thank you.
Thanks, Kate, and thanks to all of you. I know a number of you are self-isolated, and hence the benefit of having this call-in opportunity for to speak to Mike Shuley and Karen. Thank you for participating, and again, we're planning to do this again on Friday morning, so we'll be in touch. Thank you so much.